Well, having a primary care doctor that you trust and that knows your personal history can be so important to your overall health. This is especially true as we age and potentially have more and sometimes more complicated health challenges. A good doctor-patient relationship can go a long way in getting and keeping you healthy. So to give us their tips on making the most of this important relationship, we have Chris Williams, Chief Medical Officer of Central Valley Health Plan, along with Kevin Green, Director of Humana. So thank you both for being here. Over the past several years, this is what I have stressed, is that you really have to be proactive about your health and to make a relationship with your primary care doctor so that they know how to treat you as an individual patient. So let's start here. What exactly is a primary care provider, and why should Medicare beneficiaries focus on developing and maintaining a positive relationship with their doctor?
You are raising a great question, and before I talk about what is a primary care doctor, I would really like to talk about who we are and who our primary care doctors are.
Yeah.
So we are the Central Valley Health Plan, and as the name suggests, we live and breathe in the Central Valley. We are based in the Central Valley, and we have a plan-to-plan arrangement with Humana. So we are able to bring in their extensive resources in the form of complex care, their Centerville pharmacy, and their extensive network resources that helps us as well. We are happy to announce to your viewers that we are contracted with the Sante Physician Group.
Oh, great.
And they are they are one of the largest physician groups in the Central Valley.
I've had them on the show many times.
There you go, yes. And they are about 1,800 physicians strong, and we also are contracted with MedPro, the Central Valley medical providers, and they have another 900 physicians in their network. So we are able to bring to bear a lot of network resources through the Humana, through the Sante physicians, through the MedPro physicians, and with St. Agnes, which is an established brand in the Central Valley. So we are able to provide optimal health care for our members. Now, going to your question about the primary care physician, the primary care physician is the focal point of our healthcare initiative.
Right.
And our members go to the primary care doctor for almost everything in terms of routine visits, screening visits, annual wellness visits, and to have referrals sent over to specialists. So at the Central Valley Health Plan, we believe that we want to be able to support this. And what we do is we are able to provide tools to the physicians to be able to, have reminders, and we also support our members by having our health coaches provide education and counseling. We have our care navigators and case managers provide them with support as well. So we do all that we can to act as an effective catalyst to be able to support this physician-patient relationship between the primary care doctor and the patient.
Well, I think that's great information, because just like you want your doctor to know who they're treating, you should know who your doctor is, what groups they're a part of, what support systems they have to help them treat patients. So when we're talking about patient-doctor relationships, and it's a very personal thing, and we talk a lot about this when we're looking for therapists, but we should also talk about it when we're looking for primary care providers. What advice do you have for knowing when the relationship is right, or developing that relationship with your primary care physician?
That's a great question. I'm so glad you asked that question. So like with any other relationship, this is a relationship that's really grounded on mutual trust and respect. Your doctor would have the medical expertise, but you know your health.
Yeah.
Absolutely. And you know your lifestyle. You know your priorities. But by having that dialogue with your medical provider, you are able to kind of empower yourself in your healthcare journey to make some shared decision making.
Yes, I think that is so important, especially over the last few years, is you know your body, and I talk about this with my doctor all the time. I know when I am sick. I know what it feels like. I know what medications work for me, and my primary care physician has been my doctor since I was little. So that relationship is really long and really strong, and he trusts me and I trust him. So looking for that is really important. But we're also here today to talk about Medicare. So for our viewers who are enrolled in Medicare or who are not enrolled in Medicare, how should they start?
Yeah, that's a great question, and I'll step in here, Doctor. I think it's, we always advise our prospects or Humana members to have a checklist when they visit their primary care physician, because it's really all about communication.
That's true.
So we ask them to consider things like, family history, future health goals, and then current health goals. So you spoke about, you knowing your body better than anyone. And so we feel like opening those lines of communication builds that trust. And so with Humana, we want to be the vehicle where we offer the health coverage to be able to visit and have that relationship with the primary care physician.
A checklist is so important because doctors are very busy, and so sometimes there just isn't a lot of time and you forget what questions you want to ask or things that you want to talk about. So it is really important to be proactive, to take, to empower yourself to have those questions ready. So those are some great tips, and that helps people make the most of their visit. Any last tips for improving our relationships with our primary care doctors?
Well, I'll start with one from Humana. It's a benefit that's built in for all of our members. It's a health and wellness rewards program called Go365. So when our members are visiting their primary care physicians and having their preventive services done, annual wellness checks, flu shots, things of that nature, they're going to earn points, which they can then cash in for rewards in the form of gift cards anytime throughout the year. So it helps serve as a friendly reminder that if I haven't seen my doctor this year, maybe I should go do that, and then I'm going to get a gift card in addition to building that relationship.
Okay, I have a story. I used to work for a place that did something very similar, and we would get credits for doing these wellness checks, and my health was probably never better than that period in my life. My bad cholesterol was so low that it wasn't even detectable. And those are things that I never would have known had I not been incentivized to really look at my health and take control of it. Any last tips from you, doctor?
Well, so just to recap what we just talked about, your primary care doctor is like your medical home base, and make sure that you are able to feel comfortable enough to ask questions, have an active dialogue with your primary care doctor, which is so important to empower yourself in terms of your healthcare journey.
Well, I think these are all great tips, great reminder to take control of your health, to be proactive, and to find, a doctor and a relationship that works for you. We will have all of Humana's information online if you'd like to learn more. Thank you both for being here. I appreciate it.
Thanks for having
pleasure.
us.
Thank you.
And don't change that channel. Dean Richards has today's entertainment update when we come back.